I'd like to demonstrate a simple test you can use at home to see if you may have a lower back problem, more specifically a pelvic alignment problem. So what we're going to demonstrate here is called a prone leg extension, and it's a way that we can tell whether the pelvic joints are out of alignment and subluxated. It's a simple test you can do at home as well if you suspect someone may have an issue here that may need some chiropractic adjustment. So what we're going to do is, first of all, Mehdi, I'll get you to lift your right leg as high as you can. Okay. And lift the left leg. Okay, so it's not quite as high on the left side. So from that we may suspect that he's got some restriction on that left side of his pelvis, which may be because of some subluxation issues or alignment issues. So the next thing we want to check is we go to where the joint is and we press around, and quite often it's going to be very tender and sensitive, and that's another way we can tell that it may need some further assessment. So what we're looking for here is to see if the sacroiliac joints, commonly known as the pelvic joints, are tender. So we find the pelvic joints with a dimple. So we see there's a dimple on this side and a dimple on this side, and the dimple sits right over the top of where that joint is. So if we press in on this side, how does that feel, Mehdi?
Good.
That's good. And we're pressing on this side, how does that feel?
Sore.
Okay, so it's sore. And we expect it to be a bit tender or sore if there is a problem there. So based on that, we know that Mehdi may need some work to help restore his normal function and alignment through his pelvis. So if you find that someone has an issue that you may suspect is a pelvic alignment problem from doing that test, the next step would be to bring them in for a more thorough assessment.